the text message came in that said Cameron has been hit by a car. Just head to the hospital. They're getting the helicopter to come take him.
To be in the ICU, seeing my son in the bed and not being able to move is really terrifying.
The first responders gave him less than 5% chance to survive. He was 8 years old. He had a skull fracture and bleeding and swelling of his brain. He had a collapsed lung and lots of internal damage to his intestines and colon.
You can see the skull fracture that he had. This piece of bone is now pushed down towards the brain. We saw early signs of bleeding, something called an epidural hematoma. This white area is the blood, so this is the first sign that we see of blood being on the brain. Luckily, the pressures were not excessively high and were able to be controlled with medications rather than surgery. There is concern for abdominal injuries as well.
I was fortunate enough to be the surgeon that finished the abdominal surgery for him. When he was stabilized, we still weren't sure how well he was going to progress because they were quite significant injuries.
The moment that I knew Cameron was going to be okay, I was holding his hand and he squeezed my hand. I think that healed my heart because I knew that he knew I was there and I was holding his hand. To watch him relearn to walk was very emotional for me because I wanted him to run. He's 8 years old. He was just playing basketball and now he's having to learn to walk. That was hard. This is the journal that I kept in the very first couple days of Cameron's hospital stay at Penn State Health. February 14th, 2022. Your brain sensor was removed today. You opened your eyes a lot more. You squeezed our hands and you gave us a thumbs up. I also want to let you know that mine and Daddy's phone never stop. Hundreds of people are rallying for you. I am so proud of you. You have inspired so many and brought so much life and love to others in our dark days. I love you, Cameron. Cam Strong. We had a wonderful nurse, Matt, and he would just talk to Cameron like he was talking to his little brother. And that shows you that he really cares.
The care that he was showing me for my son made me feel a lot better in the hardest time of my life.
As a ICU nurse, your job is to really keep the family updated on the condition of the child, as well as make sure that the child is perfectly taken care of.
Just being able to walk and throw a football, it felt amazing.
When I see him now playing sports, it's all a miracle to me because I've seen the worst and I see him now at his best.
Absolutely 100% believe that Penn State Health saved Cameron's life.
Cameron was a level 1 trauma. That calls a lot of resources down to the emergency room. Trauma surgeons, anesthesiologists, emergency room providers, nursing staff. The whole ancillary team is available, including chaplains and family support as well. And I think that's one of the unique positions of being a level 1 children's trauma center is that we can provide care not only for the injured children, but for their family as well. Penn State Health Children's Hospital is the only level 1 pediatric trauma center between Philadelphia and Pittsburgh.
Stories like Cameron remind us that we are all here for a purpose in making a difference in this world.